Well, so one of the things we did the last time we were together, if you don't mind, is we actually problem solved publicly, and it was helpful for families to say, you know, I'll be a guinea pig, this is my situation, these are the factors, and we just really talked through, because there's so much to this, and so it's impossible for us to cover every variable that could exist as part of the equation, so we'll cover the presentation. I'm getting a look from these two.
See,
I'm already trying to go off track, but I will,
we should have put him in between us.
I'll cover the presentation. I'll cover the presentation and then we'll problem solve. But just so you know, there are programs that are operated in the state, waiver programs that are really based on an individual's resources and assets. And most children in this state do not have tons of their own money. So there are programs that support them. And it is one of the most frustrating things for parents that are, you know, working families that don't meet Medicaid thresholds, and they still need a lot of support. So we'll talk about those. Okay, thank you. You're helping me stay on track too. So what's in the presentation? We're gonna talk a lot about Medicaid. We're gonna talk a lot about managed care, which is the primary service delivery system in this state for the delivery of Medicaid benefits. We're gonna talk about long-term services and supports. We're gonna talk about home and community-based services and the waivers. And then we're gonna talk a little bit about Medicaid buy-in. And this is intended to be participating from your side. So we're not here to preach to you all night. We want you to feel free to ask questions. Anything on the slide that seems confusing or you'd like us to really spend a little more time on, probably not this slide, but as we go through the presentation, we're happy to dive in. So I think I'm still talking?
Talking for
I'll be here a while.
2 hours.
Okay. So let's go on to this one. So Medicaid provides access to healthcare services, and typically when people think of Medicaid, we think of pregnant women, low-income families, and we really focus on acute care services. Acute care services, hospitals, doctors, physicians, you know, go to your doctor, specialist, pharmacy, but really when we talk about the types of services, what we're gonna talk about today is much bigger than just acute care services. So we have 4.7 million people who receive Medicaid benefits in this state. And by and large, the majority of them are pregnant women and low-income children. I think 51% of births in this state are funded by Medicaid. And so Medicaid is a big payer of services in Texas, and really not just Texas, but everywhere. So in terms of how it works, I talked a little bit about the entitlement, and so if you're eligible for Medicaid, and I kind of separate this into 2 parts for purposes of our conversation today. So if you're a pregnant woman and you have no insurance, you'll likely get Medicaid. The birth will be covered 60 days post-delivery. You're not in Medicaid anymore. There are children who are low income that will stay in Medicaid, you know, through their childhood. But one of the biggest parts of Medicaid, it's the smallest part of the system, but it's probably in terms of cost, it's one of the biggest drivers. And to me, it's really the heart and soul of what I really loved about Medicaid, was what we talk about, the services and supports for people who have physical disabilities, those that have intellectual developmental disabilities, behavioral health issues. And that is the array of benefits that are really designed to focus on specific needs of an individual. This system grew up over several decades. It's kind of a puzzle to put together. And one of the toughest things for families is nobody expects that you'll know every waiver that exists and what the authority is and whether it's a state plan or whether it's a waiver or whether it's an entitlement. And we get caught up in acronyms because we have more than we can even keep up with. But what we really want to make sure you know today is what are the types of services and supports that exist? How do you ask for them? How do you, when you get to the place where you need help? So many people, they wait without any support, and about the time they have a major crisis and they try to access services, they find out the wait for that service is 12 years. Do your very best to keep it together. Maybe consider moving to another state. But the truth is that there are, look who's here. Hi. The truth is that there are a lot of paths to access these services that are not tied to just standard, calling and getting services. The state offers diversion programs. We offer paths that if you're in a facility-based care, that you can access community-based services without a wait. So we'll talk about all of those dynamics today. Let's see what else I'm going to get into.
Just a little more.
I have one more. See, I'm really bad about the PowerPoint stuff. So frequently used Medicaid benefits. So when we talk about people with disabilities, doctors and hospital visits are really important. Personal assistance services, personal care. So assistance with activities of daily living can be instrumental activities of daily living. These are the services and supports that allow individuals to wake up, get dressed, brush their teeth, be able to eat. But when we talk about services for people with intellectual and developmental disabilities, we also focus on services like habilitation, really around skills acquisition. So there are a lot of things that are just done and performed on behalf of somebody, but then there is really a major component built in, hi there, that's really designed to help somebody learn skills that can support themselves. Community first choice was really one of the highlights of my career, although it didn't work out just like we hoped. But community first choice was a state plan entitlement that we brought. It was authorized under the Affordable Care Act, and it was the first time we ever had an entitlement program for people that had intellectual and developmental disabilities. Before that, people had personal care needs. They didn't always meet the criteria for our state plan benefits. But this was a path for people to access services. Part of the challenge is you have to be Medicaid eligible to get these. So if you're sitting there going, well, we can't even get to the front door, then how do you pass go to get these? We'll talk about that today. Durable medical equipment is a really important component. Nursing services, and we have a lot of individuals that really have specialized needs that require nursing supports. Therapy are major parts of the system, both occupational therapy, speech therapy, physical therapy, psychological services, and then pharmacy benefits, which are an important part. Just like that, I've covered my first piece. I'm going to turn it over to Emily, who bosses me around all the time.
Gotta stay on track. Okay, hey everybody, I'm going to talk about the service delivery mechanism in Medicaid, so you understand how you get services, who is delivering them, how they're coordinated, things like that. So, you can go on the next slide. Almost every Medicaid beneficiary in Texas gets their services through Medicaid managed care, and you might wonder what that is. And that is a system where an organization, we call them managed care organizations, but they're commonly known in commercial insurance as HMOs. So you guys know what HMOs are. You probably see billboards all the time. Just for some examples, especially those in the Austin area, you might see United, you might see Blue Cross, Superior, Dell Children's. That's what a managed care organization is. So you have kind of a concept of what that means. So in Texas and in many other states, but in Texas, almost everybody in Medicaid is getting services via managed care. So what that means is instead of kind of the old way of doing things, which you would just go to the doctor would deliver the service, or the attendant, or whatever service you're getting, and the state would directly pay them just a fee. There was a set fee. Now, these MCOs, they are responsible for coordinating all the care. So a member, which is somebody who's on Medicaid, would choose an MCO, and they'd be able to choose an MCO, and they can also change MCOs. And then that MCO is responsible for contracting with all the doctors, all the hospitals, pharmacists, nursing facilities, the attendant, the home health agency, the DME companies, and getting everybody the services that they need. So sometimes that will be just as simple as going to a physician, and you just go. Other times there are services that need to be authorized. And we're going to talk about the two managed care programs that are specifically for people with disabilities, where most people with disabilities, either a physical disability or an intellectual developmental disability, are getting their services.
And I always say, if you think about how many of you have private insurance, you know, your insurance company is paid a premium either by your employer or contributed partly by you. They regulate your healthcare services. They probably drive you crazy sometimes. So think of managed care in terms of a capitated system that we've described is really the same thing. It's a model built just on the premise around a private insurance, but this can be much broader because it can include services that your private insurance company would deny if you ever asked for them, probably.
Right, so instead of the state paying every individual doctor and hospital who are billing directly, they pay the MCOs a set fee per person based on the risk and how many services they're likely to use, and then the MCO is responsible for delivering all the services. So, Star Kids. So we're going to talk about the two programs that people with disabilities are likely to be enrolled in. That's a managed care program. The first one here is Star Kids. This is a relatively new program that rolled out 2 years ago. Time really flies. It seems like it was more recent than that. And this is for children and young adults who are under 21 and who have disabilities. So the two kind of ways that those children are getting in the program are they have like SSI Medicaid, and they may have a disability, may need an attendant or some private duty nursing, have a complex condition. And then the other group of children that are in that program are children who are on a waiver. So we're going to talk very in depth about waivers in a little bit, but the Medically Dependent Children program is one waiver that all of the services are delivered by the MCO in that program. So if I'm a child and I'm an MDCP, the Medically Dependent Children program, I am getting doctor, hospital, pharmacy, MCO, and I'm getting respite, attendant, pediatric. If I am a child who is in one of these other waivers listed on the last bullet, which we're going to talk about too, those are the waivers for individuals with intellectual and developmental disabilities. Those children are getting their acute care through Star Kids, so the doctor, hospital, pharmacy piece, and the waiver services, those extra services that help them live in the community, those are going to be delivered outside of the MCO, but the MCO and the service coordinator and those delivering those extra services are supposed to coordinate on the care. So that,
How many of you have heard of Star
if
Kids
you've heard of
before?
Star Kids, you know of Star Kids, you know that's something.
Have you heard of that before?
Yeah.
Some of you not heard of it before? Have you heard of MDCP before?
And
Okay.
I'm going to talk about the
You've got
next.
some questions on this slide. Any questions?
Yeah,
Okay, do you want to?
sorry. You mentioned SSI Medicaid. What is that? Because if we're SSI disabled, like we're disabled but we make too much money, so he doesn't get anything from them, but under SSI he is deemed disabled. So is that something, another route, or is that,
So,
sorry.
can we?
Yeah, we can come back.
No, we don't have to come back, but, so I just want to make sure we understand. So, in the scenario you're describing, who has SSI? Your son has SSI?
He doesn't have SSI. He
He doesn't.
qualifies for SSI based on disability, but
Oh,
the
but
income
his
piece.
family.
So there, at this point in time, he doesn't get Medicaid because he doesn't qualify for SSI because you're in, it's depending on your.
Yeah, they said,
He's under
SSI
18.
is viewing him as disabled.
Yes.
So when he turns 18, he'll get
So
something.
that's a good,
That's
that
great.
he's met that. How? Oh, yeah. So then, the one thing that we're gonna talk about in a little bit is, these Medicaid waiver programs, and most of the waiver programs don't look at frontal income. They just look at the child's
Okay.
income. And once they get into the waiver then is the door to
Right.
eligibility for Medicaid.
But then so the Medicaid, that when you had mentioned SSI Medicaid, that's something just through SSI?
No, once you get Medicaid, Medicaid's Medicaid.
Okay.
And so she was just
I
saying,
was
one of the
confused, yeah.
eligibility doors is SSI, another eligibility door is a waiver.
So there's those doors that depend on the
There are a lot of
income.
doors.
There's, yeah, there's many doors,
Okay.
but the doors that depend on the income.
I just thought maybe there was a Medicaid we didn't know about.
And then there's the
Yeah.
other.
Medicaid's Medicaid.
But people that have SSI, they're deemed eligible for Medicaid. So if you have SSI, I mean, not in this scenario, because he would qualify, but he's not drawing down SSI. If you were receiving SSI, then the state receives a fee from the Social Security Administration, and every single person that has SSI is deemed eligible for Medicaid.
Okay.
They don't apply, but it has its own unique challenges because, in October, when they get an extra check, that they may be deemed not eligible for Medicaid on the basis of income.
A month and then they're back on.
So there's some clunkiness to that, but in this scenario you described, if you'd be willing to talk to us, so your son's 6 years old, what's his condition?
He's severely autistic, nonverbal, with self-injury and aggression.
So,
There is, and we're gonna get to the buy-in piece, but he may or may not qualify for the buy-in.
I wonder,
And then
have you
we'll
pursued
also-
diversion either?
I think we're gonna
We're gonna get into that. You stay tuned, we got some.
We'll get there.
Any other questions about Star Kids?
Is anybody's child right now, do you all have children under the age of 21 who are on Medicaid and in Star Kids? I know a couple of people.
My son has Medicaid, but I don't know what he has.
How old is he?
He's 11.
Okay.
But it's been a battle of on, off, on, off.
Okay,
because
so
of
he
the
has
income.
SSI.
Yeah, he has SSI,
Okay,
yeah.
so he's in Star Kids.
So we didn't qualify for the money. They sent me a letter that we are not gonna supposed to qualify, which I've been dealing with this, where they send me letters and they say we're not supposed to have. And then they send, you know, like they send the checks for, I mean, I don't know, and then I find out that, oh, well,
Take
our
that.
computer system is down.
And now your own.
And so then I owe them like $3,000,
Yeah.
and, you know, and I'm like, well, sure, you know.
Yeah, that's
And
an SSI.
So it's, yeah,
Okay.
but it's a mess.
I have a question. So if you do qualify for a waiver or a buy-in, can your child be in Star Kids?
Yes.
Yes.
Yeah, Emily talked about MDCP, and MDCP is really the pathway that most families use for children that don't have SSI, but parental income is really not going to permit qualifying. And MDCP is a 1915C waiver. It's a very limited benefit package, but it is the path. If you get into MDCP, you get full access to Medicaid.
What does that stand for?
It's a medically dependent children's program, and it's based on, MDCP is really, we're gonna get to the details later,
Yeah.
but MDCP is really a waiver that waives off of nursing facility care. So for kids that have complex medical conditions that they would qualify to go into a nursing home, obviously, we don't believe that kids should live in nursing homes. So, in lieu of nursing home placement, you can access MDCP services. So it may be another one to, I'm looking at you now, but it may be one that we can also talk about.
And that's true for all of these waivers, and again, we're gonna get into them, but the criteria there is that it's an alternative to living in an institution. So people can live in the community and live with their families or in their home. And so the member who goes into that program has to meet an institutional level of care. So meaning they would have the condition that they would otherwise be in a nursing facility or in an ICF or another institution. So we can talk about that more too. We're gonna get all into it.
Yeah, I think we're getting into it.
Where it's a little bit, it's kind of like you talk about the waivers, you talk about managed care, but they kind of get intertwined. So, I'm gonna move on to Star Plus because it is also a program for people with disabilities, but it is a program for adults. So this is for those who are, a child may have been in Star Kids, and once they age out of that program, as we say, they will go into Star Plus. And it's a similar to Star Kids in that it provides acute care services, the doctor, hospital, pharmacy piece, as well as the long-term services and supports. And Star Plus has two pieces to it. So you could be a person, an adult with a disability who is SSI, and you don't meet the level of care for a nursing home, but you need other services, like you need an attendant to come in. And if you have SSI Medicaid and you're in Star Plus, you can get those services. The other piece of Star Plus is like those other waivers, and that it's a bunch of extra services to keep somebody in their home or in the community rather than a nursing facility. So some of those extra services would be home delivered meals, extra therapies, nursing, things like that. So home modifications, I think we have a list. We have a list later. Day activity and health services is actually something that somebody could get without being in the waiver. So that would be if an adult needs to go to a center during the day. Right. So the important thing to also remember about both Star Plus and Star Kids is that the idea is that the MCO, and whether this works perfectly in real life is always a debate, but the MCO is responsible for coordinating all the care. People in these programs get a service coordinator who, the member is supposed to have their phone number, they can call them, and they get a service plan based on their needs for whatever is medically necessary. And that service plan is person-centered, so it doesn't just take into account someone's condition, but it takes into account, what's their living situation, what are their goals for their personal life, or maybe for work, things like that. And so those, again, Star Plus, like Star Kids, an adult who is in one of these waivers listed here, these IDP waivers that we'll get into later, could also be in Star Plus, receiving their acute care, doctor, hospital, pharmacy through the MCO, and then
learns this, and we learn stuff when we come to meetings like this too.
Okay, so I'm
So,
we're gonna go to this slide that says Medicaid home and community-based waivers. Got it. You're close.
One, I think,
Couple more.
Couple more. We're skipping some, we're making it harder.
We're making it difficult
We're just gonna
for
skip
our-
a couple.
I think one more. There you go.
And one more. So, does anybody in this room, a couple of people I know have a Medicaid waiver already, but does anybody really know what a waiver is, or are your sons and daughters and family members on waiting lists for these services?
Can
Some.
you explain the waiver?
Sure. So a Medicaid waiver is a way for the state to ask the federal government for permission to use Medicaid dollars to pay for services for people in their homes and communities instead of in a facility. So instead of a nursing home or instead of a group home where there's 6 or more people, the state can say, instead of providing services for people in those settings, we would really like to take the Medicaid money and use it creatively to support somebody to live in their homes, in their community. And so the state of Texas right now has 1, 2, 3, 4, 5, 6, 7 waivers, Medicaid waivers, and they're all a little bit different. So when the state applies to do a waiver to the federal government, they get to say who they're gonna serve, so they get to decide the eligibility. Are they gonna serve children? Are they gonna serve children and adults? Are they gonna serve people who qualify for services, like who are medically fragile and qualify for services in their nursing home? Or are they gonna serve people with an intellectual or developmental disability who qualify for living in a 6-bed or more group home? The state gets to determine that. They get to say how many people they're gonna serve, if they're gonna serve people across the state or just in small areas. And so the state, since I guess the early 80s, Texas has been doing Medicaid waiver programs, and they're really incredibly powerful, and they have made all the difference in the world for people with disabilities to live a life that they want, children to live in families, adults to live in families, adults to live on their own, surrounded by family and friends, instead of living in kind of a group congregate setting, instead of, not very many people want to live in a nursing home or a place where they have to go to bed at a certain time, and they've got, children have to go to bed at a certain time, but when they're an adult, they don't want to go to bed at 7 o'clock, because the staff person leaves. So these are Texas waivers, and we're gonna go through all of them a little bit, and then we're gonna give you the presentation by email, so that you all will have it, and you'll have who to call to get on these waiver waiting lists, and then how to go about doing it. And then if there are emergency situations, sometimes people have a situation that's such a crisis situation that they can get a waiver without some of the long waits that are happening. So we'll talk about that.
Can I say there, just so you know, like you might wonder,
Sure.
why are they called waivers? It's basically the state is saying we are waiving the requirement that people have to live in a facility to be eligible for Medicaid, and we're asking the federal government for a waiver of that to
Right.
these other programs.
Right.
So that's just where it comes
And
from.
are all of these income and?
We're gonna talk about that.
Yeah.
We're gonna go through every one of them.
They are.
So we're gonna go
But on
through
the
all of,
individual.
we're gonna go through all of them, and I'm gonna tell you a couple stories, and then we're gonna come back. So if just suspend all your disbelief and remember your questions, and we'll get through this, and then we'll start kind of problem solving. Otherwise, I think we'd get bogged down and probably not get through any of it. Okay, so there are the 7. You keep going.
Hey, Elizabeth, you have a question back here.
Kind of stepping in a little bit late, so I just wanted to make sure, get clarification. So all these waivers and things that we're talking about, does this only apply to a child or an adult
We're
that
gonna
needs
get in-
services? But
we're
does
gonna-
it only apply only for those individuals? Or would all this apply also for children who don't necessarily meet the requirements where they would have to be in like an assisted living or?
Well, I think I'm gonna answer your questions when we get there. I think that we'll answer it. But if not, then at the end of it, because I'm not exactly sure, can you wait until we get through the end of it, and then we'll
I mean, a quick
go back.
answer is, they all have eligibility requirements
have
that the
age.
individual has to be.
Right.
Okay, so all of them are like different degrees. We're
Yes.
not talking about all of these, you have to at least meet the requirement that you need assisted living.
No, it's all,
Oh, no,
No,
they're
no,
all.
it's all
Different
different.
requirements.
okay,
Yeah.
so you can keep going. medically dependent children's program is the first waiver program that I was gonna talk about. This is a little guy, Eric, who's the son of a friend of mine. Eric was born prematurely, but Carla and Eric almost both died during delivery, but Eric was born with significant medical needs, along with cerebral palsy, and he needs lots of medical stuff. Uses a wheelchair to get around, uses a G-tube in order to get to eat. And so he doesn't have speech, but he uses a communication device where he can communicate his needs. He's got some intellectual disabilities, and so Carla was working, actually we were co-workers, and she was really struggling because she had military insurance, but it didn't pay for some of the long-term services, somebody to come in to help out with Eric when he got off the school bus, somebody to help with Eric so she could sleep at night, because there were periods of time when he'd get really, really sick and he was up all night long. He'd go to the hospital sometimes for 2 months out of the winter, and so it was really difficult, and she was really struggling. So finally Eric came up on the medically dependent children's program interest list, and he was able to then get medically dependent children's program services. And so those services included respite, so that she could hire somebody to come in and give her a break. And she could hire a nurse to do that, or hire a personal attendant to do that, somebody who's paid a lower rate to help Eric with all of his needs. She also got some home modifications, so she could widen some doorways and build ramps into the home, because Eric used a wheelchair and it was hard for them to navigate. She also used it, she could do some assistive technology, like putting in some tie downs in her vehicle so that the wheelchair didn't, was safely secured. So when Eric got into the MDCP program, MDCP didn't look at his income, her income. They only looked at Eric's income. And so once he got into the waiver, not only did he get these waiver services, these few waiver services, but it gave him access to all of Medicaid. And so all of those things that that Medicaid provides. So for Eric, he was getting from medically dependent children's program, Gary said it was a limited benefit, it is. He was mainly getting respite and some home modifications and some adaptive aids, but really what it gave him was access to the bigger picture. And so with that bigger picture, he got private duty nursing, so a nurse to come into the home. He got personal care services, so somebody who could come into the home to help out when Carla wasn't, she was exhausted, working and trying to take care of all of Eric's needs. So she actually was able to hire her brother to come in to help provide some personal care for Eric. It also paid for some of those things that her insurance company didn't pay for. So some of the supplies or durable medical equipment that sometimes are limited with a commercial insurance or even the military insurance. And so that made a huge difference. Now as Eric, this waiver is only for people who meet eligibility for a nursing facility. He does need it because he's medically fragile, and it only goes until the person is 21 years old. The good thing about that, though, is the state was smart and decided that we don't want these children to fall off the face of the planet when they turn 21, so we're going to give them automatic admission into the adult nursing facility, the adult waiver that waives off nursing facility, which is, in a minute, we're going to talk about. It's called the Star Plus waiver. And so that was Eric is taken care of. And he's doing really incredibly well. And he's been on MDCP for a number of years now. So,
and you still sit on the waiting list, the other waiting list while you're running.
Correct. Eric is on, when Carla put Eric on the interest list for a medically dependent children's program, she also put him on the class Medicaid waiver interest list and the HCS interest list. Those interest lists are a little bit longer. His name got called first for this waiver, and so she took it, but he's not losing his spot on the other waiver waiting list. Okay. So I don't think there is a way for children who are very medically fragile and need medically dependent children's program to get onto the waiver. The waiver is about a 5-year wait. Some kids are really medically fragile and they opt to do, they're deemed so medically fragile that they can get the service. This is kind of a silly policy that we created. But they go into a nursing home for a limited period of time in order to then get access to the waiver pretty immediately, so it's like a 24-hour stay. And some families, children are so fragile that they opt to do this. It's not easy, it's not, it's very difficult for families, but we've got kids that are on, that'll